Hello and good morning, everybody, to our latest webinar. Today's webinar is focusing on coping with culpability, responding to the workplace anxieties related to COVID-19. So this is your latest series of Engage EHS webinars, and we're very excited today to have an expert panel. Some you will recognize from previous webinars, and a new member of our panel today as well. So what we're going to be covering, some of the key headings, is how the current situation is affecting stress and anxiety in the workplace, new pressures placed on the health and safety teams, and then tips for safety teams to adapt to the current environment. So before I introduce the panelists, I want to just run through some quick housekeeping. For those who have been on these webinars before, you would be well familiar with this. So what we would like to do is take questions throughout the webinar. Now, typically, we try to answer as many questions as we can, but normally we get quite a lot. So what we will do is make sure we respond to everybody. So if you can submit your question through the Q&A tab, as you see there on screen, it's on the right-hand side. You can also raise a hand as well if you have a question on the topic we are in the middle of a conversation on. And there's also a chat. But if you can keep that to the Q&A for any of your questions, that would be fantastic. Okay, so just to make the introductions. On the panel today, myself, Billy O'Brien, I'm Director with Engage EHS and responsible for customer success. My background is in environmental health and safety management, and I'm solely responsible for making sure all our customers are successfully using our product, the health and safety system, and getting value from that. We also have on our panel today, we have Peter Kinselli, Associate Director at Cardinus Risk Management. Cardinus Risk Management is a leading health and safety risk management specialist company offering online and on-site solutions. Peter has over 20 years experience implementing health and safety management systems within larger corporate organizations. So welcome, Peter.
Yeah, Billy, hi, good morning to you. How are you?
Great, and great to have you on board. Thank you again very much for joining.
Yeah,
and we also have Heather Beach, Managing Director of the Healthy Work Company. The Healthy Work Company offers face-to-face, webinar and e-learning delivery for client companies. Heather has been running businesses in the health and safety community for over 20 years and is a specialist in organizational cultural change. So Heather, welcome. This is your first webinar with us. So
I know, I'm excited and trepidatious at the same time.
Oh, listen, it's just a conversation. All the friendly people that have joined our webinar this morning, always very friendly, and loads of good questions. And hopefully we'll have some good tips and solutions for the guys out there. And like we always say, we don't claim to have all the solutions, but we certainly have good conversations. And really, it's relying on experience from everybody that's listening here today. So without further ado, we might as well get straight into the topics. So the first one, as I mentioned, is really the current situation, with COVID-19 in the workplace and how that's affecting, the well-being, so the stress and anxiety levels within the workplace. So I suppose, Heather, this might be an area that you've been doing some work in, certainly over the last number of years, but I'd say more focused on this area in recent months.
Yeah, 100%. I mean, so there's a couple of things. We started a healthy working group to support people in working from home on Facebook, which actually anybody here is very welcome to join. I know we've got a couple of people from that group on the session today, and we've been sharing experiences. A lot of health and safety and HR people on that group as well. And we also ran webinars with our customers around home working and how people were coping with that. And that gave us the impression, which actually was a false one, that people were coping really well, because we were hearing things like, I'm getting more time to myself. I'm reconnecting with my family. I'm smelling the flowers for the first time in my life. Yeah. So we thought, wow, this is really interesting. So we ran a survey actually about probably 2 months into lockdown, and we had got a completely different picture. What we got was actually 1 in 3 people were really struggling with their mental health in a way which was worse than usual. 1 in 4 people were flourishing. So there was a real sense of extremes in what we were seeing, with people saying things like the uncertainty was the big aspect that was really concerning them. And I think if you look at the different circumstances that we're all in, with some, some worrying about being, made redundant, some working in really difficult circumstances with kids and with and caring for people and not in the best environment, and some on the other end of the spectrum who are on their own. The one thing which unites all of us is this uncertainty. And our brains do not cope well with uncertainty. We release those stress hormones, which then can get us into a spiral and can lead to us being sick effectively. So that's what we're seeing, which is obviously really concerning.
Yeah, that's very interesting, because in my own situation, I would be traveling quite a bit. And when the lockdown happened, all of a sudden, no travel. It was great. It was like being on holidays.
Yeah.
The car didn't move. I was working from home, but I was able to do stuff in the garden. The weekends seemed longer. You weren't as tired. But then the holiday was over. So then is this going to continue? Because I think, certainly me and maybe a lot of people expected, this will be all right. Somebody is going to come up with something to fix all this. This can't go on for much longer. But we're still here. So yeah, it's interesting.
And one of the things I would highlight is that because what we're seeing, we're talking mostly to health and safety professionals, and what we've seen in that particular group of people, and HR people as well, actually, is that they are working so hard. Yeah. They are absolutely pulled in every direction. And that, I think, is such a challenge to role model good well-being and be, pulled in every direction as they are at the moment.
Yeah, and I'd say, Peter, you're probably seeing a lot of that with your clients, and that feedback, health and safety professionals feeling maybe overwhelmed. You have your day-to-day stuff to do that you would have been always doing as a health and safety professional, but now you have a new thing, I suppose, to deal with.
I think you're right there, Billy, because I reflected on starting this seminar that we ought to really look at sort of the period that we've been through, because as it stands at the moment, we've got Ireland that's on 134 days of lockdown, UK on 143 as it is today, and as many of you guys are aware, that if you're looking at this from a behaviour perspective, in that period of time, behaviour actually changes, but also we're faced with those conflicting stressors that Heather is actually identified, so there's the good side and the bad side to it. I think from a business perspective, we need to also look at this from a point of view of actually, there is a massive cost. So again, coming back to it, if you look at it from a UK government perspective, they've invested over £300 billion into the current economy to keep it afloat, and that's got to be recovered somewhere. And again, that's reflected in other governments across Europe, Ireland, Germany, France, Spain, etc. There's a massive investment by government. And also, if you look at the uncertainty of people, we've got 9.3 million people on furlough at the moment. So actually that uncertainty is actually creating anxiety around jobs and, sort of how businesses are going to, sort of retain. And then we've got that little thing in the background, which is very much around Brexit, that is going to affect regulation as we go forward as well. So I think, when we look at this, it's really important as safety professionals, if you start talking about what do we need to do and the type of pressures we're under, we've got to keep up to date. So this whole piece around culpability, we've got to really reinforce to ourselves, we've got to actually make sure our professional practices are up to date, but actually we are moving with this whole situation.
Yeah, and it's, it is adding a lot of stress and pressure. The cost factor, the UK is now in recession. That was announced a couple
yesterday.
Yeah, and that's, undoubtedly would add more concerns and worries. It's just another thing to add more anxiety. And I suppose just looking at a couple of, on the ground issues then that the health and safety professionals have to deal with, it's introducing these new guidelines, about social distancing, having to wear face masks, hand washing, and trying to get people to buy into that. You can see it in your local communities that not everybody buys into it, and it has to be, enforced. But who's the enforcer? And that puts a lot of pressure, I think, on health and safety people as well. I'm sure, from an on-the-ground health and safety professional, you've been talking to your clients, Peter, but also as well, maybe from a social side, so from tactics and tips that people can use emotionally to try and get people to buy in. I suppose there's probably ways around that as well.
Yeah, I think the important thing is that, as safe professionals, it comes back to a number of things. One is we've got to engage with our leadership teams. We've got to inform people what's going on in the business. And we've got to really sort of almost look at this as a, sort of a chance to reset everybody. So if we're bringing people back to work, we need to reintroduce them to the workplace because there's new rules. And again, one of the things we've got to be really clear on, even if we were to have a vaccine today, the supply chain is going to take about 18 months to be able to make sure that that's in place. So whatever measures we introduce at this point, they're going to actually be sat with us for a long time. So, we need to be talking very much in this point. We also need to be making sure that our leadership team are really clear about what the messages that they need to take into their teams. And I'm really sort of a bit boring on this front, because I talk to leadership teams and they say to me, right, okay, what are the things we need to do? And I say social distancing, hand washing and ventilation. We need to make sure that our messages need to be, we need to social distance, and that protects us. We need to keep our personal hygiene up, because that protects us as an individual. And the last thing about ventilation, it stops the spread of the virus. The better the ventilation is. So, and again, I talk to people about open the windows, and there's all sorts of, quips about it's noisy outside, it could get cold, etc. But we need to think about people. So, the discussions we have to have, we're going to have to be fairly straight about it, but we need to actually work off a sound foundation as well. So we need to keep up to date. Our knowledge needs to be, we need to keep our professional practices up to date as we possibly can.
Yeah, I think you hit on the point there as well. There has to be consistency in the messaging, and the people delivering that message. So, from senior management team all the way down, everybody is responsible for their own actions. But also as well, management need to be seen to be following through. So,
Sorry, and one last point I would make is, we need to remember that whoever it is, whether it's a senior leader or somebody, sort of more junior in the business, we need to actually have a simple message that people can convey to one another. And again, one of the things that I'll touch on that probably Heather would talk about as well is the fact that we need messagings that actually talk about kindness and consideration.
Yeah, absolutely. And that probably brings us on nicely then to looking at maybe the few aspects of the well-being. So I know we're going to cover this in the next slide. So what are those three aspects or key points of well-being that, both management should be looking at with their own employees, but also us as individuals? We're responsible for our own well-being, so I think it's kind of twofold really there, isn't it?
We think it's threefold. There's a third aspect, but and I think this has kind of been missed from a wellbeing perspective to date, and it's really good opportunity. I think, as Peter said, this is a real reset for people, Because if we think about the way we've looked at well-being in the past, a lot of it has been about individual well-being or peer-to-peer support. So lots of people on here, I'm sure, will have mental health first aiders, and a lot of that's all really about individual well-being. And what we as an organization believe that well-being is interdependent. So it's you as an individual, you have a responsibility to understand yourself really well, be self-aware, understand how to manage yourself and what's going on in your life, and the types of things that help you to thrive as an individual. And often people don't think about that, and that's where training comes in. And there's so much research been done, in particularly into positive psychology at the moment, which looks at the sorts of things which really help people. And so that is a really good place to start. But equally, the bit that's kind of got missing is management. So as a manager, how do I support my team better? And as health and safety professionals, I'm not sure how much we felt empowered to train managers in creating a well team, or whether we've seen that as something that HR should be doing in some way. But whether it sits in HR or health and safety or wherever it sits, it's an integral part of your well-being strategy that managers need to understand how to have a conversation with someone that's struggling, and also in the light of their legal requirements, which is not something that mental health first aid covers. So again, you just need to make sure that your manager is trained in that. And then the third aspect of the wheel is organizational well-being. And, we do have a legal requirement to do a stress risk assessment as an organization. I'm not sure whether anybody on this call does one. We've hardly found anybody that does. But right now, it's not a bad idea to at least check in with people and find out how they're getting on. Would they like to stay working from home, or would they like to be in the office more? Have they got the equipment they need? As an organization, are we providing them with things that are helping them or hindering them? Is our communication working? All of those types of things, which just are sensible, self-aware things for an organization to be asking itself.
Yeah, it's actually interesting when you brought up the point of doing stress risk assessments. Funnily enough, the first thing that popped into my mind is that as health and safety professionals, we do risk assessments with pregnant women in the workplace, because we're trying to identify stressors and issues that they have to deal with, and so it's really quite similar.
Yeah, I mean, it's interesting because a lot of health and safety professionals will be involved in individual stress risk assessments. Yeah. So if somebody has an issue, has been off sick with stress, they'll come back in and the health and safety professional will do a stress risk assessment with that individual. But that isn't the part, the legal requirement is to do an organizational stress risk assessment. And that's where the value comes in. And I think it gets put in the too hard box for people quite often, as in, it's too hard to collect the information. When I do collect the information, I'm going to find such a horrific picture that I'm not going to want to tackle it. But the reality is there's always quick wins in there, always. And even if you can't tackle that thing immediately, you can at least tell people what you're doing in order to tackle it and ramp up the communication on those aspects that are really creating stressors for people, like technology that doesn't work, for example, those sorts of things which make your life more stressful.
Yeah, absolutely. So, Peter, prove head or wrong. You've seen plenty of organizations do organizational-wide stress risk assessments.
I can't prove her entirely wrong. I know of at least two, but also I recognise that stress is one of those topics that when you start to dip your toe in, particularly in some of the financial services organisations that I've worked in, that people don't like some of the discussions or outcomes, and I think going back to what Heather was saying about the challenges that health and safety professionals face is that it has been up to now quite difficult to find a vehicle to engage, and I think actually there's a broader vehicle here that people could look at. So when you're looking at your health and wellbeing programs prior to COVID-19 or the coronavirus pandemic, we were focusing on certain topics, mental health being one of them. All of a sudden we find ourselves with the coronavirus, actually there are at risk and vulnerable groups. So some of those groups are those with respiratory issues, but actually diet is a big issue here. When we look at it, anybody at the moment, and who suffers from diabetes sits in the high risk category.
Yeah.
So when we look at health and wellbeing program, I think one of the opportunities that this particular environment is, provided for the health and safety community is actually to revisit this particular topic and actually start looking at it on actually how do we support the business with a wellbeing program that keeps people at work healthy. So that means there's a what's in it for me benefit, but also there is an organizational benefit here as well.
Yeah, I agree. I think that's a really, really great point that Peter's just made there. It is a real opportunity to reset that. The only thing I would say is that one of the challenges with this topic is that everybody has their own individual cocktail for being well. Yeah. So if you happen to be in an organization with a lot of similar types of people who, for example, all like to get their real sense of well-being through being incredibly fit, then you might want to work on something around, gyms or those sorts of things. But a lot of people get it through things like human connection. They get it through learning and just educating people on the whole range of all of those factors which go into creating good well-being, and then allowing people the opportunity as a body to understand where do we as an organization think that our money best, if we've got, is it in this area, is it in educating on food, is it in providing better food in the canteen, or is it something about creating opportunities to connect with people or creating learning opportunities, or what is it for our demographic that's going to make the biggest difference?
Yeah, and interesting as well that, I know a lot of health and safety professionals who maybe haven't gone down that road of doing organizational stress risk assessments, or as both of you said, you haven't come across too many that have. What's the best way for them to start? Or, is there a format or a template either of you would recommend that people could use, or is there any resources out there?
I mean, you could start with the HSE's own, the management standards themselves, which they do have a lot of support in there. So if you wanted to run your own questionnaire or something from that, you can do it. That we run surveys, but we always find that it's better to combine surveys with employee workshops, because you get a very different perspective from stories. And when you hear those stories, you can also ask people what they love about working there. What do they really, what project is the best project they've ever worked on? And then you can learn from success as well as learning from those aspects, which are perhaps, more of the stress risk factors, as it were.
Yeah. And I think like anything, the more you do it, like it's not a static document, it's dynamic, so you're going to learn as you progress along that journey. One of the things I really liked in this graphic is, it's a focus on you as an individual. So be the best version of yourself. There's only so much you can control. You can only control you. You can't control outside factors.
Well, we came up with that because what we were hearing was a lot of worry and concern around things which people had absolutely no control over. And as human beings, we do tend to default to worrying about those things. But we recommend that whenever people have got a worry, that they actually use that box. We actually add, it's the Stephen Covey version that we generally use with people, which is, can I control it? Can I influence it? Or is it completely out of my control? In which case I need to reframe it in some way.
Yeah, brilliant. No, really good. And I suppose that leads us on then to, some of the new pressures that health and safety professionals have to deal with. So there's various items that we have them on screen here, whether it's PPE, increased workload. So is there any topic there, I suppose, Peter, in terms of something that stands out to you that you want to maybe identify?
There's a number of areas. If we just start top left. So from a perspective of PPE, one of the massive concerns I've got at the moment that this seems to be the gold standard for protecting people from the COVID virus. And I would, to me as a health and safety professional, I cringe every time, we talk about, you know,
Yeah.
face masks or the like. I have a colleague who I work with who, you know, actually, you know, jumps up and down and gets very excited every time somebody shows a picture of a person wearing a face mask, because she wants it face fitted.
Yeah.
And if you've got a beard, that's even more important to her. You
Yeah.
know, my reminder to people about PPE is that, you know, I've been down the old NEBOSH learning routes, you know, so old Eric, you know, comes very much a long way down the hierarchy of controls. You know, we need to see PPE as the last resort.
Yeah.
So when we come back to these conversations around, you know, our leadership teams, we need to keep reinforcing to people that actually there's stuff that's more important: social distancing, washing your hands. I'm sounding a bit boring now, aren't I? And ventilation, you know, rather than relying upon PPE.
Yeah.
You know, and again, I'm having a conversation later on today about plastic screens in an office, and you know, I'm going to get back to those boring three. I think that's important. That leads quite nicely onto the second one. You know, reduction in workplace capacity. You know, from a business perspective, we want to get people back working normally. And I'm going to talk to you guys about, you know, patience over panic. And what I mean by that is that, you know, again, just bear in mind, we've been in lockdown 143 days. You know, that's a long time, or in Ireland, 134. You know, this COVID, you know, stuff is not going to go away. So we should plan our return to work. What we should do is look about bringing people back and doing it so that we can reduce the anxiety and stress that people are facing in the workplace. Yeah. So, you know, that is such an important aspect of this. And then this thing around increased workload, you know, I think also what we need to do is, you know, come back to what I've just said about, you know, patience. We're in this for the long haul. So what we should be doing, you know, as organizations, is hitting that reset button and actually asking ourselves some questions about, you know, what are the learnings we can get out of this particular situation.
It's actually interesting on that increased workload. I just briefly caught a report on a radio station this morning that a study was done recently, and they're anticipating that people will work on average, if this continues for a year, an extra month of work. Wow. Based on the time they're going to save traveling and the time they spend on other activities like water cooler conversations, coffee breaks, and so on. So, you know, an extra month is a huge amount of productivity for any organization per individual.
Yeah. And unfortunately, that also you've got the other side of the coin, which is that employee burnout is going to be the big risk, isn't it?
Exactly. Yeah. And that's something, again, going back to our previous discussion about stress and how to manage that, and you know, having proper well-being programs in place to deal with that before it becomes an issue.
And I think for me, I this whole topic is fascinating for me, and we're going to build some training on it, because I've actually burnt out myself in the past. And the reason I did is that I absolutely love work. So work feels like play to me. And I bet you a lot of people on this call would relate to that. You know, it's something you really enjoy. You get learning out of it, you get connections, you get, you know, all of those good things. And then I forget that actually work isn't play. And actually you have to rest. You have to rest. You have to have hobbies. You have to have, you know, the right amount of sleep and all those other good self-care things that you need to build in. And also when we're working all the time, we're always in that stress cycle. And if we don't find a way to close that off every single day, that's when we end up with those stress hormones flying around our bodies. So I think right now is a time to be talking to people about self-care, even though it sounds really fluffy. If we don't look after ourselves, we are going to end up with a bunch of very burnt out people.
Yeah, perfect. Hold that thought. Don't give any tips away just yet, because we have a nice little section at the end where we give some tips and guidance to everybody.
Lovely.
Yeah. Billy, the other thing I would talk about, just highlight within this slide, is the one about senior management buy-in. So from the health and safety team, I would just say to everybody, you've got it. This situation actually has presented you with that opportunity, that you've got an open door there. So, you know, my advice to you is be brave, take it.
Yeah, that's a very good point. And talking to a lot of our customers as well, they're finding that there is a huge amount of management support. Like unfortunately, you do have the exceptions, and that I think that's always going to be the case. It's human nature. Some people need to be dragged along. Other people can see what's happening and are very proactive. But I think you're right. Health and safety professionals need to grasp. There's a saying around here: grasp the nettle. And run with it. So that's something I think. Yeah, safety professionals need to recognize that and do it. Take action. Yeah, good point. Very good. Okay, so I suppose what we'll do, maybe moving on to the next section, because conscious of time, we're 30 minutes into the webinar, and I know everybody is extremely busy, so we want to make sure we cover as much as possible. So really, this next heading is, how can health and safety professionals cope with these new pressures? We've, all sorts of restart protocols, people going back to work, writing up policy and procedures. And one of the challenges, especially with COVID, well, particularly I suppose in the early stages, the updates were happening, it seemed like on a daily basis, but that's probably a bit of an exaggeration, probably a weekly basis, new signs and symptoms, new control measures and so on that people had to prepare. But I think, Peter, maybe this is a nice one for you, maybe just to give us an overview, what are we looking at here in this graphic, and how people, can cope with those pressures as an organization and then as a safety professional.
Yeah, so I need to start off with the, actually your professional practice. And the first thing I would say is you need to take care of that. And again, this comes back to this, patience versus panic. The situation we find ourselves in is that there are increasing pressures on us to actually be experts on topics that maybe we're not. We've got changing legislation, so not everybody has taken the steps that the Republic of Ireland have in setting out a nice timetable for the resumption of life as normal. So the relaxation of the lockdown measures. So one of the things I'm going to really suggest to you all is that you're going to have to give yourself some permission to actually allow yourself time to bring yourself up to date. So that pressure you're feeling on, I need to be an expert on this, you don't. What you really need to be able to do is actually spend some time looking for information from resources that are appropriate. So, please, Facebook is not a good place, okay? So it's really, really important that, you actually focus on websites that provide you with, information. So from a UK perspective, a good central point for getting information is from the BBC website, because they draw information in from Public Health England, from the government websites. They also draw in information from CDC, which is the Centre of Disease Control. Now, the Centre of Disease Control is really quite important because actually it gives us information on the SARS virus and also, some of the research. Now, looking at this, we're asked to pass comments on actually, how long is stuff going to, how long will the virus be live on surfaces? Are the cleaning products, that we're using correct, etc. And I think it's really, you need to take that time to actually find that information. So you are going to feel pressurized, but the time you spend doing your research will really be long-term benefit, because it'll be easy after that to keep up to date, to actually, be able to go back and refer. And also when you're challenged, and you are going to be challenged along the way, because, people will, well, isn't it a meter in the UK with precautions that so I can bring back people to work, so I don't need to worry about 2 meters anymore, question mark. Yeah. Well, actually that's not correct. The government rules actually state, first off, if you can work from home, work from home. Mm-hmm. The second one is there's a 2 meter rule in place, and it's only unless you work in an environment where you can't, socially distance, that there's an issue. You can socially distance in an office. So, you've got to look at this from a point of view of that, trying to be able to answer the questions. So bear in mind, the title of this presentation is Coping with Culpability. If we don't develop our professional practice and we don't understand we are culpable in this.
Yeah, yeah. And I think that adds pressure to the professionals out there, because they are aware of that culpability, and it's just trying to get the time in their workday to get up to speed, to get the learnings, avail of those trusted resources that you've mentioned to get your information. And I think you have to be quite demanding, I think, as a professional with your time, because it is your professional accreditation that's at stake there as well, your professional standing, and you need to protect that as well. You've worked hard to get to this point, and you need to protect it as well.
I think also you need to do this for your own confidence. And again, this would be something that, would touch on an area that Heather would, reflect upon, because, we need to be secure in, when we're talking to people. So, to actually have that security that I've done my research, I understand what the issues are, but also you've got great opportunities in, by attending presentations like this. One of the reasons why, I'm grateful for the opportunity to talk to people is the fact that, it gives me a good chance to try and influence people to actually improve their professional practice. But the reason why, and again, it's about taking care of ourselves, taking care of our knowledge, but also then when we're presenting that, we can do that in a balanced way without feeling that we've got to get down to the nitty gritty. I'm confident enough to stand in front of a chief exec and say, the things you need to do are, those three things, social distancing, wash your hands, good ventilation. I don't need to press any harder than that. Yeah,
and that's it. It comes back to the simple points, isn't it, that will protect us. So I suppose, Heather, anything to add there, in this piece, just around organizational preparedness?
Not really, apart from that, as Peter said, I think that the great thing about today is that we are seeing so many people prepared to share their knowledge for free and to work together. And we've sort of lost the armor that we had in terms of showing off. A lot of LinkedIn was always, I've done this amazing, great, wonderful thing. And I think we are now realizing, we need to really work together to try some things to see what work. The only other thing I would say is that, yes, absolutely, doing things right, but equally a culture of experimentation isn't a bad idea in some of these things as well, but being then prepared to examine what worked well and why it worked, as opposed to just doing it and hoping for the best.
Yeah, no, exactly. And I think as a profession, sometimes we were inclined to overcomplicate things and make it look maybe more complex than they needed to be. And I like, Peter's piece, confidently stand up in front of the chief exec and say, it's simple, these three things: social distancing, hand washing, and good ventilation. We don't need to make it complicated. No, that's pretty good. Okay, so we're on to the final piece. Some tips. So I know, Heather, you've been holding back on some tips and suggestions around well-being and how people can cope with this. And so in terms of, we've kind of broken this area out into organizational based measures and people based measures. There's probably going to be a crossover in both. So who wants to go first? Who has tips that our audience would be only too happy to head on board?
Peter, do you want to do organisation-based measures? Because that's probably not my bag in quite the same way.
No, I'll do that. I mean, Heather, I know I'm going to be very polite. I spoke quite a bit just then.
That's all right.
So do you want to start with the people stuff, and then I'll follow in with the organisational-based stuff?
Oh gosh, now you've put me under pressure. I thought you were going to go first and I was going to have a chance to think.
I'll tell you what, I'll just go ahead.
Go on.
Okay, so from an organisational perspective, I think it's really important that what we do as safety professionals is that we need to really have a look at our policies and procedures. And I did notice that as Q&A process, there was a question around this. Now, I've already spoken to you guys about looking at actually the future, looking at your, sort of the way your health and wellbeing program should focus on, the SARS, and actually making sure that, it fits in appropriately. So when you look at this from an organizational perspective, we need to look at it from a number of things. So one is, have we got the right policies and processes in place? And this can be, as fundamental as, again, this is me keeping stuff simple. Your cleaning products should be, sort of based on 5% bleach. So, if you could actually look at it from that point of view, really important. Hand sanitizer, if we look at it from a point of view of an organization, everybody's using hand sanitizer. How many of you have looked at what the risk of using hand sanitizer 4 or 5 times a day does to your skin? I would encourage you to start looking at some nice moisturizer to give to your guys, because actually alcohol-based sanitizer strips your skin of its fats, and reduces the strength of your skin protection. So it's important that what we do is we start looking at stuff like this. When you look at sort of the longer term, you need, if we're thinking about 18 months time before a vaccine's in place, if we had one available today, do your risk assessment programs actually consider COVID? Do they actually consider social distancing and all those other things within the processes you've got? Again, you're probably looking at stuff like if you've got a sales team, they're starting to travel, are you actually looking at, what do you need to do to keep them safe? Now, I've been out and about visiting clients for the last 6 weeks. We have risk assessment protocols in place, for myself and the consultancy team. Last night, we were informed that somebody has got one of our consultancy team has come in contact with somebody who has tested positive. We've got a process in place to follow up and deal with that. And what we're able to do, therefore, is react very quickly to it. Again, from a workplace perspective, you need to actually have a look at, if we've got an issue, so we've had an outbreak, how do we contain it? Because the important thing for us is we need to maintain work as it stands. We need to try and create an environment where, as safety professionals, we're focused on, we're keeping this business moving by keeping the people healthy within it.
Yeah, and I think that's a good point on just on that work example, and hopefully everything works out with that. But I think as safety professionals, we need to, write up our policies, have our procedures in place. But if something happens, such as somebody coming in contact with somebody who tests positive, is not be afraid to analyze the process. What worked, what didn't work, and bring in the stakeholders as part of that. Because it's everybody's involved: employees, management, line managers at different levels. So bring everybody in and talk about the process.
Again, I agree with you. I mean, the previous slide actually sat a process of looking at, where we're at now to where we, to the learning. I think one of the things that, I find particularly frightening is that a lot of organisations are sat here today, got a business continuity plan in place. They activated it, back in March. Probably didn't work very well, but actually, what have you done to review that? And the challenge that we've got is we get busy and we get involved in stuff, but actually we don't learn from the mistakes we've made. Yeah. And again, if you look at, there's a load of famous quotes about, about learning from your mistakes. I mean, I like my Reggie Perring moments where I didn't get to where I was today because, I made quite a few mistakes along the way, is the way I'd finish it off.
Yeah. That's how we learn.
It is. And the good stuff is the stuff we go down the pub, have a pint with our friends and brag about. We don't learn from it.
Yeah, no, that's it. Exactly. Okay, so Heather, back to people now. So what tips have you got for the professionals out there and, employees in general?
Well, before I talk more specifically about that, one of the things that I think is an opportunity from this period, and Peter and you have also referred to it, is this idea that we can actually start to think about becoming learning organisations. So making it okay for people to fail. A lot of successful people are perfectionists. I discovered last year that I was one as well. It was quite a shocker discovering at 50 years old that you're a perfectionist when you didn't know it. But if you're somebody who has really high standards for yourself and for other people around you, you've got potentially perfectionist tendencies, which mean you hate failure and you hate other people around you failing. That isn't helpful at this period. And actually becoming an organization which actually doesn't just tolerate failure, but actually actively wants to learn from it. This idea of black box thinking, is so important to consider at this point in time. Yeah. So I think in terms of people, I think what's important is that we're all thinking about who we are being in this period. What are we doing to reflect that? So, are we actually taking a bit of time to breathe and think about our priorities and think about how we want to come across? Nick Wright at Vodafone was speaking to me earlier this week, and he was saying, and I absolutely love this, the 4 qualities that we want our leadership to embody are trust, compassion, stability, and hope. And if we could all come back to that, or am I actually being those things? And is what I'm saying and doing reflective of those commitments? Or am I losing my rag when someone gets it wrong? Or am I letting the fact that I'm also uncertain and anxious actually be reflected in my communications with other people? So taking a bit more time over things, even though we've got an awful lot to do, and actually being a bit more mindful. Mindfulness, it means an awful lot of different things to different people. And I know that people that are really expert in this do sit and meditate every day. For me, it's much more a question of breathing, remembering to breathe when we've got a problem, and actually just slowing down and remembering that there's nothing we can do about, you can't do much about yesterday. We don't know what's going to happen tomorrow. Just let's focus in on today.
Yeah, I think you're right. I think people cope with stress or stressors in their own unique way, whether it's through exercise or meditation and so on. But I think it is important in an organization as a health and safety professional that you don't take on all the responsibility.
Yes.
You have to have that stakeholder team around you, and it's a consultation and it's a learning process.
And the other thing that for managers that's really important is that you have people managers who are the right type of people manager. I mean, this is, if you do not have those in your organization right now during this period, it is really going to show up, because for so long we've promoted people to people management based on their technical skill set. But if they're not empathetic, if they haven't got emotional intelligence, if they can't have those individual conversations or see the need for those individual conversations, they're not going to be the right people to get you through this period, however good their technical skill set is. And for me right now, the most important thing for managers to be doing is having one-to-one conversations with people, understanding where they are as individuals, what their circumstances are, how they're coping, how they're feeling. And that unfortunately has gone up in importance for those people managers in your organization.
Yeah, and whether that's people that are back in office or in the production facility, or people working from home, pick up the phone, give them a call, see how they're doing. No, that's a good point. So we've covered some absolutely brilliant topics, great tips there from both you guys, so really appreciate that. We covered a lot of questions actually as we were going through. I know, Peter, you highlighted a couple there. So we are really running on pressured for time. There's just one question there. Maybe, Peter, you might help me out with this one. So just when would you mandate COVID secure procedures into policy for companies as they are currently and constantly changing? This person is on version 20 of COVID-19 risk assessments in their business.
Okay, so what I'd be inclined to do is that if you're on that many versions, I'll just bring back the, sort of the most recent update for, offices was the 22nd of May. So, where I would be is that I would actually, again, come back to this whole point about taking a little bit of time to reflect. So my advice to you would be is that the government advice actually hasn't changed for many industries since that period of time. Now, if you're based in the Republic of Ireland, the timelines actually and the advice given were pre-published. So actually, you should be able to get to a point of not having to change what you're doing.
Yeah.
What I would start looking, though, is actually looking longer term to, rather than having specific COVID risk assessments, I would start looking at your task activities that you've got at the moment and then start including your COVID precautions in there.
Yeah.
And again, I would try and, again, get back to my point, hold your ground a little bit, because actually if the regulation's not changing, why keep, sort of evolving your the risk assessment process, because there's probably time better spent elsewhere on the stuff you're doing.
Yeah, no, absolutely. Yeah, no, good points. I'll cover one more question, and I think we covered this maybe in our last webinar, but we'll go over it again. So this is a health and safety professional managing an organisation that goes across multiple jurisdictions. So UK and Ireland, so Scotland, Wales, and the different policies there. But I think we covered this the last time, and Peter, correct me if I'm wrong, but I think as you just said in your last response, the government guidelines are quite consistent, at a high level. And quite straightforward. Maybe don't give us the detail that we'd like within specific organizations. But again, it's following the World Health Organization guidelines, CDC, and so on. So jurisdiction really doesn't matter. Well, it matters in specific areas, but overall, your policy and procedure should be broadly the same.
Yeah, so again, I've got to reflect on the, we've got client groups that cover most of Europe, Asia, and US. What we've done is there are, and again, through the World Health Organization, you can find that information. There are links to the government websites. So, what I'd be inclined to do, and most of those have feeds. So what we've done as an organization is for our client groups, we've actually found the websites, had the feeds come through to us to be able to keep ourselves up to date. But basically, most of the advice that follows, is really social distancing, either 2 meters or 1.5 meters. It doesn't get much smaller than that. Face masks generally are, sort of worn in places of public transport. There's a lot of commonality in the advice. So, if you are managing across, sort of a wide range of jurisdictions, start the World Health Organization. Again, as health and safety professionals, it's really important that what we do is that, we're very much tapped into the International Labour Organization, the World Health Organization at the moment.
Okay, brilliant. Well done. Okay, so I said that was the last question. I am going to ask one more question and maybe direct this at Heather. So a lot of organizations, not unlike ourselves, would provide a lot of, well-being events, whether it's social events, whether it's fruit in the office, whether it's bringing in, mindfulness teachers or yoga sessions into the office. How are organizations going to be able to do that going forward? Or,
well,
down to the risk assessment.
Well, to be quite honest with you, I actually think it's a great time for a reset, because at the end of the day, is there likes of fruit in the office, social events and yoga sessions what your people actually want? Or are you providing those because that makes you feel good that you're doing some well-being? At the end of the day, right now, people have got some fundamentals that need taking care of. And I would actually look to understand what's going on for your people and what would help them. So I do know some organizations are doing things like they're saying have half a day off a week, because you've got to do something restful in that period, because otherwise you're going to burn out. Some organizations are doing financial things because people are worried about money, and if you're worried about money, no amount of social events or fruits in the office are going to help you. So if you're not taking care of the hygiene factors, forget those things. Do those things first before you worry about those. There are things you can do online. So, you know, obviously you can do training with organizations like us, which allow people to look at what really works for them from a perspective of thriving. Or you can do things like mindfulness sessions online. We've actually done gongs, which has been amazing. I absolutely loved it. I found it really, really restful. So there are things you can do. But before you do those, my beg of you is that you actually ask people what they need right now to support their well-being, and then perhaps help to provide that first.
Brilliant. I think that's a brilliant note to finish on. You know, go out and ask people what do they want. Absolutely. Guys, I really appreciate your time today. That was a fantastic session. I've certainly learned a lot. I think our audience out there with the questions that have come through have been very good. We will follow up on all the questions that we haven't touched on. I think we've got to most of them throughout the conversation. So I want to thank everybody on the panel, and, you know, particularly our audience out there for spending the time. We probably ran a little bit over, but I think it was well worth it. So again, thank you everybody, and thanks for attending our latest webinar.
Thank you.
Thank you.